Okay, so I'm going to call that good enough time to start. We're going to get going. We're going to do some brief introductions of some of the folks that are going to be speaking today and throughout the year, I guess. And then I'll tell you a little bit about what the purpose of this initiative is and how it's going to be structured. So my name is Leslie Carver. I am the provost of Marshall College. I'm sort of a host today, so I'm going to go through some things, but the expertise really rests with a couple of the other folks that are here. So Shibangi, do you want to introduce yourself?
Sure. Hi, everyone. Good to see you all. My name is Shibangi, and I'm actually a recent alumnus of Marshall College. I just graduated in 2020. And yeah, I'm really excited to be here today. And later I'll also be presenting along with Natalie and Ashley about the student organization Intersectional Health Project. And we have many project teams going on from this last year, ongoing this quarter, that are some examples of student projects that you all can create as a part of this program.
Great. Dr. Tanaka.
Hello, my name is Elaine Tanaka. I'm a alumna of the UCSD School of Medicine, last century though, actually, I'm embarrassed to say. But I'm also involved in teaching as a lecturer in ethnic studies. I teach an upper division course, and I'm going to be presenting on some health disparities in San Diego later on. I'm also founded a nonprofit called Compassion Breast, which is providing breast care to uninsured and under-resourced communities. So thank you for inviting me, and I look forward to talking.
Thank you. Dr. Atkinson.
Hi, everyone. My name is Arthur, and I used to be a TA in the DOC program. So for those of you that have experienced the DOC program, hopefully you have. You should all be Marshall students, or maybe some of you aren't Marshall students, but the DOC program is a really cool program. Now I'm not in the DOC program anymore, but I'm teaching TMC 15, which is Public Service in America, and then an honors seminar, TMC 20, which is about social movements, and then a sociology class within the sociology department. So happy to be here.
And I don't know if Ashley and Natalie want to introduce themselves as well. If you want to, please go ahead.
Sure. I'm Ashley Medina. I am in Mayer College, actually, and I'm a member of IHP. I'm an officer. So, yeah, I'm a junior also.
Nice to have you here, Ashley.
Senior.
Hello, my name is Natalie. I am a second year co-vice president of IHP, and I'm a human bio major. So a little bit about me.
All right, thanks for coming, everybody. I just want to welcome you to this event. This is really the launch for the Health Disparities Initiative, Public Health Initiative for Marshall College's 50th anniversary. I'm really glad to see, actually, Ashley, that you're a Muir student, because this is really something that's for the entire campus. It's not just for Marshall students, but Marshall is sponsoring because it's our 50th anniversary this year. So it's really important to us because of the theme of Marshall College being really focused on being engaged citizens and being involved in our communities, that we do some things in celebration of our 50th anniversary that face outward to the community and offer some help and support to the people in the community. So this is just one of the many things that we have going on this year for our 50th anniversary. This is going to be a year-long program. Some of the other things are sort of one at a time kinds of things. We're also very, very excited about them. In fact, tomorrow, if any of you are Marshall students and you're interested, we're having a panel with some of the alumni from Marshall's founding class. So those are the folks that were really at the beginning of, speaking of social movements, Arthur, the social movement that led to the formation of the college. So I wanted to briefly go over a little bit about the purpose of this initiative. Again, this is really something that we initiated because of the tradition in the college of serving our communities and being active citizens, and also because of the health disparities that we see in the community, especially right now. I'm sure everyone is aware that the COVID crisis is hitting underrepresented communities far more severely than those of us who are white and affluent. So we really wanted to do some things that allowed our students to have the chance to get involved in projects that actually seek to make a difference in the community. So that's the purpose of the initiative. We're really hoping that you will get involved, and we're actually going to make an opportunity for you to develop your own projects that address the public health concerns that are most relevant and important to you. And over the course of the year, and I will go through a schedule in a few minutes, what we're going to do is teach you about public health disparities, and also teach you about how to develop proposals and develop projects. So Shvangi is a past president or co-president, I assume, of the Intersexual Health Project. And we have a couple of current folks from there. And that's just one way that you can get involved. There are other opportunities to be involved and create your own ideas and projects. This initiative really is for anyone on campus who's interested in addressing health disparities. So that might be public health students. It might be pre-med students. It might be students who come from some of those underserved communities and wants to reach out and work with the folks in those communities. But it could also just be other students who are really interested in making a difference, even if their long-term goals don't include public health or medicine. Okay, let me see if I can do this. Of course I can't do this. Hold on, I'm gonna mess up the slides for a minute. Okay, so the way that the initiative is going to work is every other Monday, starting today, we're going to have Zoom Lives from 6 to 7. The first meeting of winter quarter is actually going to be a public service fair. So that's an opportunity for you to learn about some of the organizations on campus and in the community that seek to do some of the things that we're hoping to do with this initiative. The format is always going to be dinner and discussion, so feel free to bring your dinners and eat them in front of the screen. If you're like me and you don't like people watching you chew, you can turn off your cameras. And then each is going to be for 1 hour, except for the fair will be for 2 hours. If things change, but I don't think they will, that could be in person at the Price Center. I think it's really unlikely that we'll be able to have large in-person events in January. So one of the things that we would like to do over the course of the year is to get connected to Livewell San Diego. So this is a community organization that's really all about addressing health in the community. These are several of the current partners that they have. We're trying to move towards us becoming one of their partners. But one thing that we learned is that is a longer process than we expected. So we're not currently a partner, which means they won't be as actively involved as we originally wanted them to. But these are some organizations that you can reach out to if you're interested in working on any of the things that they are working on. Okay, so today is week 3, obviously. So we're doing the introduction. Dr. Tanaka is going to talk to us in a little bit about health disparities in San Diego. And she, in addition to being a physician and a lecturer, she also runs a nonprofit that seeks to address some of these issues. And then we'll have the students from the Intersectional Health Project talk about some of the student projects that they have done and are currently working on, just to give you some flavor for what sorts of projects might be possible. In 2 weeks, Professor Atkinson, who is teaching in the public service minor and very actively engaged in the minor, will be moderating a panel with students who are in the minor. We'll talk a little bit about the minor and how it can help you to develop projects. And Dr. Atkinson is also hopefully going to be talking about the Ashoka Changemaker group on campus. And so we have a connection with a professor who's been involved in that group. So hopefully we'll also give you some information about them and what they do in a couple weeks. And then in week 7, we're going to talk a little bit about other ways that you can get engaged and get actually credit for what you do as part of this initiative. So we're going to have a presentation by someone from the Teaching and Learning Commons who can talk to us about the co-curricular record. And a lot of the groups that already exist, you can get co-curricular record on your transcript for that. And we will probably also be asking to have just participation in this year-long project be certified for a co-curricular record. If you don't know what that is, they'll give us more information during week 7, but essentially it's that you get a page on your transcript that says things that you've been involved in besides the academic side of what you do. We'll also talk to some folks from nonprofits in San Diego that serve to address health disparities. And then we're going to have a little bit of time for you to brainstorm some of your own ideas and things that you think you might be able to or be interested in addressing. And that's it for this quarter. During the beginning of winter quarter, we're going to have a public service fair, likely virtual. We are going to try to engage community service groups from within San Diego, and we have several connections, both in this group right now, but other people as well, including some alumni and some UCSD student groups that do community service. And we're probably going to run that as a series of breakout rooms so that you can kind of move between groups and learn about what the different groups do and how to get involved with them. And then, so winter quarter is really going to be all about developing projects and writing proposals and mission statements. So there's going to be some practical information about that during week 3. And then in week 5 and moving forward from then, we're going to have some opportunities for you to actually work in your groups. So that might be you paired up in groups, or it might be that some of you start bringing friends in, and that's totally fine too. We're going to have a student panel to talk a little bit about some of the advocacy work that they're doing, and that hopefully will also help us to figure out ways that you can connect with other students, other student groups, and also alumni. Week 9, we're not going to actually meet, but you'll be able to do a brief update about what you've done so far, and we're hoping to put together a celebration of what we have learned so far and what we hope to continue to achieve throughout the year. And then in spring quarter, we're going to be doing some development of posters so that you can give presentations on your projects and let each other know about what you've done. So a lot of the spring quarter will be about helping you prepare those. And then doing the actual presentations between weeks 3 and 5, and hopefully having a big celebration during week 6. So I'm going to stop sharing that. That's all I have right now. Before we move on to Dr. Tanaka, does anybody have any questions about the schedule or the timeline that we just talked about? Okay, so Elaine, if you want, you should be able to share your screen. And so she's just going to talk for about 10 minutes about what some of the challenges that we're hoping to address with this initiative are. Is it working?
Okay, can you hear me?
Yeah, we can hear you.
Okay, perfect. I'm going to full screen this. Okay, so first of all, I just want to thank the organizers for inviting me to speak tonight. And like I could go on and on about health disparities, but I'm just going to limit this to 10 minutes and kind of just try to give a big overview, starting from really, really big globally down to San Diego. So I thought it would be nice to start with just talking about life expectancy. And if you look at comparable countries to the United States, you see our life expectancy at birth is unfortunately low compared to sort of the average life expectancy of 82.3 years. So that's something to keep in mind as we focus more and more locally to San Diego. One of the metrics, there are a lot of metrics we have that look at how good is our health compared to other countries, to compare to other states or cities. And life expectancy is one of the ones that is kind of easy to relate to and think about, but there's many ways to look at it. So if we kind of now start looking at the United States in particular, we see that in California, we're actually pretty good. Our life expectancy is above 81, which is great. But you can see here in the Midwest, in the South, I guess this is more the South, you can see the life expectancy can be below 76. And so you see this great variation within the United States itself. And I put this chart in here just to show life expectancy by gender and race in the United States. And you can see here that if you're in the United States, all through time pretty much from 1970 to 2017, being a white woman is a good thing in terms of life expectancy. But unfortunately, being a Black man is a bad thing in terms of life expectancy. And so we're going to see this sort of theme, both based on gender and race, echoed through the rest of my presentation. But I just thought this would be a nice way to kind of give a big overview and kind of give an idea of some of the disparities that are occurring in terms of health. So I have these numbers here. These are estimates, of course, because the census we're just having right now. But you can see in San Diego, we have a lot of people. We have 3.3 million people. Total population in California is over 39 million. And thinking about this, you know, it's good that we have a high life expectancy in this state, but it's something to think about. Anything that we do in terms of health in San Diego affects a lot of people. So it's a very important topic. So if there's a disparity between certain groups, that means a lot of people are being affected. So this here, I got a lot of this data from a report, and I'll show you the reference, but this is San Diego region life expectancy itself. And you can see the darker green you are, the better it is. So you can see certain areas of San Diego have really a lot better life expectancy, like region 20 here, which corresponds to Sweetwater. But then regions right here, like region 30, which is Jamul, has a much lower life expectancy. So you can see that there are differences even within San Diego County itself. And before we start really honing in on specific health diseases, I thought it would be nice to have this chart here just to look at in terms of what is, how do we look at disparities? How do we look at health differences and how do we really start to define and pinpoint what the cause of disparities are? And I like this chart a lot because it shows here on the y-axis the quality of health. And obviously you want your blue bar to be as high as possible. And then down here, it shows you that group 1 compared to group 2. And you can assign whatever group you want to here to these bars. So if we looked at life expectancy that we saw earlier, that I just showed a few slides ago, we could say men versus women. And we could say women is group 1, men is group 2. And then why is there a difference in their life expectancy? Well, it can be due to multiple different things, including social circumstances, environmental exposures, behavioral patterns, healthcare, and that includes access to healthcare, as well as even genetic predisposition. There's a lot of literature looking at this, and I have to say genetic predisposition is one of the lower factors. People always hear about, genetic diseases causing breast cancer, things like that. But actually the incidence, the number of breast cancers that are due to genetics is very, very small. So actually, most of the disparities are due to these other factors rather than just genetics. So I got a lot of the information I'm going to show in the following slides from this statistics report put out by the County of San Diego. I highly recommend it, and the source is here, and it explains everything in great detail. I'm just going to go briefly over the data tonight, but please feel free to look at it further. And especially as you're designing your projects, it's a great resource to have. It's available online. So I thought it'd be nice to just kind of start with looking at socioeconomic. And if you look at income groups and you look at regions in San Diego, and look at the population, you know, who owns their house, how many are minorities, what's the household income. You see the lowest household incomes are these regions in San Diego. And you can see median household income is about $45,000 a year. And you can see there's a pretty high percentage of minorities in this area too, over 77%. And then if you look at, you know, percent unemployed, you can see that's higher than other regions. With a high school diploma or less, you can also see it's higher than other regions. Speaking English, kind of varied a little bit here, but if you look at the percent that rent versus own housing, you can see there's a difference. And what I'll do is the next slide shows, so if you can kind of remember these numbers, I apologize, I couldn't fit them all in one slide. But this slide here shows the highest. So this is the highest income groups. And that includes areas like Coronado and Del Mar, not any surprise to any of us who live here in San Diego. But you can see that the median household income, in contrast, is in the 6 digits. So over $105,000 a year. You can see also the percent that are minorities has dropped. You can also see the percent with less than a high school diploma or equivalent is much lower, only 6%. And then the percent who own housing is much higher. So you can see that there are disparities within regions of San Diego itself. So I like this chart a lot because it showed health income disparities by income status. And it's really colorful, so it's really easy to kind of compare different diseases. But you can see in the lowest income levels, you have all the bars are above equal. And what you really want is you want all the bars to be below the equal line because you want your health outcomes to be good. So you can see, which is probably no surprise to anyone today at this meeting, is that the highest income levels have really good health outcomes. And that's for all the diseases, including chronic diseases, communicable diseases like flu, injury, behavioral health, and maternal and child health. So we're going to start with non-communicable or chronic diseases. And this again is from 2011. You can see diseases like Parkinson's disease, arthritis, cancer, chronic obstructive pulmonary disease includes disease states like emphysema. You can see diabetes, stroke, coronary heart disease, which includes like heart attacks, and of course asthma. And you can see all these bars here. You can see what it is in San Diego County in total. And then you can see how it compares from the lowest income levels going up to the highest income levels. And you can see just by looking at the overall height of the bars that it's much higher. The burden of disease is much higher. There's much higher incidence of disease in the lowest income levels. If you look at communicable diseases, meaning diseases that are passed between people, such as COVID, and I don't have the data on COVID, but COVID would probably look very similar to, say, flu and pneumonia. You see, again, the bars are highest in the lowest income levels and lowest in the highest income levels. And in particular, diseases like flu and pneumonia, very, very much a big disparity here, a much bigger bar than in the highest income level. And the same is true of diseases like in the green bar, which is chlamydia, which is a sexually transmitted infection. Diseases such as tuberculosis is indeed higher in the lowest income levels, but it's a very small incidence. So that's why it's really hard to see and compare. But you can see how disease that is transmissible or that can be passed between people is definitely higher in the lowest income groups. So then you may ask yourself, well, what about injury? Does injury, is it different by income? And unfortunately, it is also affected. So you can look at San Diego County as a whole, but again, for the average of San Diego County, even in the lowest income levels, you have things like other unintentional injuries being much higher. You can also see things like fall-related injuries even being higher in the lowest income levels compared to the highest. And I also wanted to draw attention to intentional injury. So intentional injury is also even higher. And this kind of ties in also with mental health, which I'm going to show in the next slide. So this shows here a burden of behavioral health in San Diego County. And you see here, it's a little bit different. The low income group is a little bit higher than the lowest income group, but these two bars are definitely, these two groups are much higher than in the highest income group. And so that's something to think about. If you're wanting to impact a lot of people, you want to really try to get rid of some of these disparities, try to mitigate them or eliminate them. It makes sense looking at all this data here to really focus on lowest income groups as well as low income groups, especially when it comes to behavioral health also. And you can see here, they were very thorough. They included a whole bunch of different diseases everywhere from schizophrenia to mood disorders to anxiety, Alzheimer's, and even suicides represented here. And you can see that if you want to take something as prevalent as mood disorders, you can see these bars here are much bigger in the low and lowest income groups compared to the highest. And then the last slide for income status is maternal and child health. This slide was a little bit more difficult to interpret because there was so much data and the way it was scaled that there are 2 bars. So there's 2 bars for San Diego County, 2 bars for the low income group. But you can see again the same pattern is seen, although there's a little bit of difference in terms of infant mortality, which is this bar right here, this kind of light blue bar. You can see infant mortality is high both in the lowest group and also in the high group, high income group. So there are some. It's not as clear cut per se as in the other slides because there are other factors that are involved in maternal and child health. The thing that I think we really should look at, that's something that's related to access, is right here, live births where mothers did not receive early prenatal care, and that's this kind of burgundy bar. And to me, that has to do with access to healthcare, access to good prenatal care. And you can see that these burgundy bars are indeed larger in the low and lowest income groups compared to the highest income group. Okay, so now we're going to look at health disparities in San Diego based on race and ethnicity. And again, this is from the same agency that produced the data I just presented on income. And again, it's available online, great resource if you're interested in trying to create a program looking and trying to mitigate disparities in health. So by now you're pretty familiar with how the data is shown. So I won't explain it as much as I did for the income part, but you can see here it's a little bit more, you see a little bit more variation. What you see is you want to be, again, below the equal line. So you want to have your risk be lower. You can see, I feel fortunate being Asian because it actually looks like all my bars are lower. But I have many friends in the Black American community, and unfortunately their bars for all these diseases, chronic diseases, communicable diseases, maternal child health, injury and behavioral health are all above the line. And so when you see a chart like this, for income, you could say, well, maybe it's access, maybe, they don't have insurance. But when you look at race and ethnicities, you would really like to see everyone have really good care. You'd like to see everyone below the equal line. So the overall burden of non-communicable or chronic diseases, and that again includes things like arthritis and cancer, asthma, heart disease. You can see what it is like in San Diego as a whole. You can see it as compared to other racial ethnic groups. And you can see for the Asian Pacific Islander population, it is much lower, but you can see for other groups, in particular the Black American group is much higher than say for the white American group, although theirs is a little bit higher than the average. And it does vary though, depending on the disease state that you're looking at. So if you're looking at certain disease states, and this is where I think data like this is really good if you're looking at creating certain programs. So let's say you're really interested in breast cancer and you really want to try to, see what groups are really at risk. Then you can look at the orange bar and really compare which different groups have this burden of disease. These are groups you may want to target more in designing your program. If you look at communicable diseases, you also see some disparities. Again, we would like all bars to really be the same and be low, of course, but you can see how there are a lot of different diseases that are felt more by certain communities than others. And the thing about public health is you really want to find out why that is. What is the cause of that? And make sure you eliminate those causes. So if it's something like access, you want to make sure that's taken care of. And you can see here San Diego County as a whole. And you can see other groups here as listed. And you can see flu and pneumonia is pretty high in a lot of groups. And so this is something that I think COVID would probably be similar to, the flu pneumonia the numbers here. A bit more though, according to the data, a bit more skewed, of course, to our communities of color than probably this chart shows right now. And this is maternal and child health outcomes. And again, I like looking at this one here, early prenatal care. And you can see here that that's the burgundy line, that early prenatal care is not as available to both the Black and Hispanic community as much as, say, the white community or just San Diego as a whole. And to me, again, this is one of those things where if we provide the access, we provide education outreach, this is something where we should really be able to equalize all bars and really bring down that burden. And this is here a chart showing a burden of injury. And you can see everything ranging from intentional injury. Let me go back, sorry about that. Which is the orange bars are bigger in the Black community as well as other intentional injuries. But you can see that some things like the unintentional fall-related injuries are a little bit higher in the white community than in the Black community. So there are differences within communities when you're looking at injury. And then behavioral health also, you can see there's differences in incidence. Everything from like chronic substance related disorders, that's the sort of like a light gray bar. You can see how that's different in some communities, but you can see how communities, some communities really have some incidents of suicide, self-inflicted injuries, and it varies between communities. But this shows like the most common behavioral health issues that we see, including even chronic ones like Alzheimer's disease. So I know I went through a lot of data very quickly, and it takes a while to really look at it and think about it. So I really, I do have the resources and the links in my talk, but I want to just give a big overview about disparities. And I think one of the things that really kind of hits home for me is that, yes, they do exist in San Diego County, health disparities, and it's something that, you know, I founded a nonprofit to try to combat that. And these disparities exist both on socioeconomic level as well as race and ethnicity. And I think it's something that is really important for us, because I think we do come from a place of privilege, having, you know, earned a college degree. I know you all are in the process of earning your degree, but it gives us a way to, we've become empowered by education to make a difference. And so I would really urge you all to really see if there's anything that you can do to help mitigate and really eliminate any of these disparities. And it affects a broad range of health conditions. You know, it's not just surgical or breast cancer conditions, which is what I'm interested in. There's a whole bunch of conditions ranging from mental health to even communicable diseases like flu, pneumonia, and even now COVID. And this is my opinion here. I put this statement here. I couldn't resist putting them, but I think community partnerships are essential to addressing and mitigating, eliminating health disparities. So one of the things that we are doing right now is we have a project, with another nonprofit looking at compassion in the Black American community and what it means and how to train better those who are able to relate to patients better and deliver better care. So there's a lot of community partnerships that can happen. There's a lot of great community nonprofits out there. And so I think having that relationship is a great way to leverage your own education with the communities, outreach, already in place networks that exist through nonprofits. So again, I'd like to thank everyone for being here, and thanks for letting me talk today. And I will stop sharing my screen, and I'll be happy to take any questions on the chat too, or if anyone has questions, please feel free to shout out.
Thanks so much, Dr. Tanaka. I think we have a few minutes if people have any questions. If not, I have one. So in my other part of my life, I study developmental disorders, particularly autism spectrum disorder. And I was struck by the fact that there are disparities even in something like a developmental disorder where we think it's really strongly genetic. And so you wouldn't think it would be affected by the circumstances you're living in. And yet it clearly is based on the data that you showed. Do you have any thoughts about why that is, or what kinds of things can lead to even disparities in something that we tend to think of as really genetic?
Yeah, I think that's a great question. So a lot of it has to do with, and that's why I was stressing prenatal care. Some of it is an interplay between prenatal care and genetics. So genetics doesn't necessarily mean if someone has a gene that they'll get the disease. It just means that sometimes, especially with these multi-gene diseases, which a lot of behavioral health issues are, there's an interplay. So they may or may not come out depending on the circumstances. And some families, like I have a good friend whose son is autistic. He's high functioning autistic. And he received really great counseling early on, just from the day he was born. And he's really, I mean, you would not even know really at this point that he had any, that he was high functioning, that he, anything at all. He just seems like sort of a normal, everyday adult now, actually. So it's one of those things where, yes, there's an interplay, and there's also things that children, especially like developmental things, can be done to really help children develop and really get beyond their any genetic predispositions. The same is true for breast cancer. You know, people talk about the BRCA gene, which is a gene for breast cancer, and yes, it does predispose people to breast cancer. But what happens sometimes is, it's diagnosing people early. So if you're poor and you don't know you have the gene and you don't get diagnosed early, you will pass away from it compared to somebody who was able to get good health care and access the whole time. And there's even studies looking at time to treatment. I mean, you would think, oh, everyone, once they're diagnosed with cancer, they get treated the same, within 10 days, let's say. But that unfortunately is not true. There are certain groups of people, certain ethnic groups that just do not get treated as quickly as other groups. And so I think, again, it's one of those things of that chart I showed about disparities, how some of it is related to access, not just, genes or things like that. Yeah.
Great, thanks. So Elijah has a question in the chat. Elaine, can you see it?
Yes, I can see it. How impactful is culture on the parameters that are being shown? So I think it's one of those, it's hard to say. It's hard to tease out sometimes culture. And a lot of people, I just did a talk for the med school about cancer screening. You have to look at culture also, and how important to say is the family, and certain groups will be reached better by looking at those other factors. I know it's kind of, sometimes it's you can say, well, it's culture, like I'll give you an example in breast cancer. Like people felt that Muslim women were not getting screened because of their culture, they, and there was not that many female providers and things like that. But there's a study that came out several years ago that talked about how actually one of the biggest reasons they don't go to get screened and to be seen by a doctor is fear of discrimination and Islamophobia. So it turned out it wasn't really the culture per se, it was really some fear related to that. So I think it's hard to say. I think culture does have an impact, and maybe has an impact on how we reach communities, but I think it's very, it's risky. It's not smart to just blame everything on culture. I think you have to really look at things more basic than that, like access and education and outreach, because sometimes, patients just don't know. They don't realize, oh, we need to get screened. But once they know, they say, we have to get a colonoscopy at age 50, they go and do it. So it's a great point that you brought up, Elijah, but I think it's a little bit of a slippery slope. It has to be looked at carefully.
I'm really curious. We probably don't have enough time, but maybe at the end, if we have a little bit of time, I'm interested in this idea of cultures that celebrate those who have passed in a way that's different from what we do and what that could lead to. For right now, I'm going to turn it over to Shibangi, Ashley, and Natalie to talk about some of the kinds of programs that they've been involved with And hopefully that might light some fires into ideas of things that you can do for when you're thinking about your own projects. Why don't you take it away?
Sure, yes, I can take it over. Thank you so much, Dr. Tanaka. Again, I wanted to add that Dr. Tanaka also actually helped a lot with the planning, the whole timeline of this overall health disparities program. So thank you so much for that. Yes, let me screen share so that I can, let's see. There we go, I think. There, can you all see the slides right now? I don't think it's on the first slide. There. Okay, give me 1 second. Okay. Yes, so to introduce myself again, my name is Shivangi. I'm a recent alum of Marshall College, and Ashley and Natalie are also executive members of Intersectional Health Project, and we'll be talking a little bit about their project teams. Okay, so first of all, why was this organization created? Well, UCSD is actually situated just 18 miles from the busiest land border crossing in the entire Western Hemisphere. And because of that, it's a microcosm of global diversity and unfortunately poverty, with a regional ecology exhibiting public health, environmental, urban, and political issues that persist across borders. And La Jolla is relatively isolated from that. But as scholars and citizens, we can strive to work in neighboring communities to learn, collaborate, and drive community-based action. Moving on to the next slide, give me just a second. Sorry, 1 second. Okay, so a little bit about our mission. Intersectional Health Project is a student organization that 1, investigates, reports, and co-produces knowledge regarding overshadowed social issues, and 2, it mobilizes collaborative student community activism and problem solving. Okay, and this is an overview of all our project teams that are currently going on this quarter. It's a lot all on this slide, and we'll be talking about each of these in detail in the upcoming slides. So our first project is water quality in San Ysidro. And for some background, there was lead contamination detected in the pipes of several elementary schools in San Ysidro, including La Mirada. And the city actually came in and took care of the issue by changing the pipes in the elementary schools. They found out that it was not the source, but actually the pipes at the local elementary schools. But from that came the question, what about the surrounding area? What about the houses that were built at the same time as these schools? So for that, from that, the water quality project arose. And we started actually by canvassing the local neighborhood. We've been focusing mostly in La Mirada, and we went door to door asking residents how they felt about their water quality. And we found out that a lot of residents actually distrusted their tap water and actually went out to buy bottled water, which is not only is it not environmentally sustainable, but also it's actually more expensive in the long run. So from that, we started conducting water testing. And so far, we've used kits from Amazon to test water, but we want to collaborate with the lab at UCSD for more sustainable testing and more accurate testing. And from the water testing we did not find any lead in the limited area we looked at, but we did find high levels of hardness in several water samples, and we found some questionable bacteria, positive bacteria results, which we shared back with the residents so that they could get more professional water testing done. So from our water testing, we've also held community events where members could bring in their water samples and we tested water right there for them. But from all of that, we've been a part of community meetings where we share these results back to the community members and also get ideas from them on what we can do with this project. And I think that's really important for all these projects that we'll be creating as a part of this program, is that we really collaborate with community members and community organizations already doing similar work. And that way you can really broaden your reach and really address an issue that's needed to be investigated or looked at or brought awareness to. So that was a little detour coming back to the water quality project. Currently, we want to definitely collaborate with the lab and expand to doing water testing at other areas. From those meetings we had with community members, we got ideas about other places, older places in San Ysidro to test. So we'll hopefully be doing that in a few months. Okay, next I have a little bit about the Tijuana team. This was a clinical opportunity in partnership with the Refugee Health Alliance. And currently this project, at least on IHP's end, is on hold because of the pandemic. But before, we had students going down to serve homeless and migrant populations, deportees, and low-income individuals. Intersectional Health Project has also partnered with a legal organization called Al Otro Lado, and with this organization, students could volunteer to help cases on the legal aspect of obtaining health insurance and asylum cases. And as a part of the Refugee Health Alliance program, students are also able to visit multiple shelters on weekends and be a part of the clinic by learning skills, clinical skills from also doctors that go down from UCSD and then help practice them at these clinics. So these are some great clinical opportunities, but are on hold for the pandemic. Okay, we're also partnered with the Otay Mesa Detention Center, detention resistance, very different meanings there. But what that looked like is that they actually came to one of our GVMs to talk about the program. And we learned about the letter writing program, and all of us members, we wrote letters to those in the detention centers, and it was a pretty eye-opening experience, very rewarding for members who got letters back, and there was that connection there. Okay, next a little bit about the Community Outreach Project team. This is pictures from our first event, Medical Career Day, which we held in January of this year. And the bottom picture right there is actually Dr. Tanaka, who's was the opening speaker of that event. But as you can see, it was a conference-style event with demo sessions as well, where high school students. This was targeting underrepresented high school students from the South Bay. And we welcomed these students to the Raza Resource Center to hold these interactive demos, and they got to learn about the multiple fields in healthcare. As you can see, the right picture is a student learning how to intubate. So it was pretty interactive, which was exciting for the students. So recently, after that in-person Medical Career Day, we held a virtual Medical Career Day in July. And recently, we've transitioned into holding a mini medical career webinar series. And these are smaller sessions over a longer period of time for these high school students from underrepresented areas. And these sessions focus on different fields in healthcare, so not only MD, but DO, PT, physical physician, physical therapist, PA, physician's assistant, RN, nursing, and all of that. So yeah, that's our current trajectory with the community outreach project team. Let me skip that for now. Okay, and then Natalie, if you want to talk a little bit about the project team.
Hello, everyone. Thank you for coming. I'm going to talk to you a little about the Food Insecurity Project Team. And the overall goal of our project team is to collaborate with local food source organizations and research teams to become part of the approach to solving food security in San Diego. If you can go to the next slide, please. Thank you. And a little more about our goals. We want for this quarter, at least, we're trying to investigate into San Diego's need for alternative food source programs. This can be in the form of community fridges, gardens, pantries, using survey data. And then we want to propose potential projects to bring awareness and aid to food insecurity. Help reduce help reduce health disparities, like Dr. Tanaka's presentation. So that connects really well. And then we also want to connect with food resource organizations to create sustainable community changes. Basically, come into a community, ask what they want, not necessarily what they need. So in order to have them kind of be involved in making these solutions lasting. If you can proceed.
Sorry, give me 1 second again.
You're good. Some potential projects we are going to be working on this quarter include educational webinars, like about the health grade and the impact of food deserts in San Diego, and maybe even for a larger region. And then we're also going to be creating surveys to gather data on food deserts and the use of food assistance programs. And then we hope, or I hope to at least maybe hold a community food drive, but we'll have to see how that goes. And then for the future, after COVID, to host a farmers market that can receive food stamps. That way it's very accessible for low-income, low-access areas in San Diego. If you can proceed.
Sorry, I don't know why it keeps happening. Hasn't happened before. Okay, go back there. Yeah, I think we're on the journalism team now. Natalie.
Hi, everyone. Like I said, I'm Ashley, and I'm the head of the journalism team. So I'm going to talk about the journalism team. The goal of the IHP journalism team is to highlight community narratives on health from an intersectional lens. So like we said, the Intersectional Health Project has two main branches, which is the investigative team and the action teams. And the goal of the investigative branch is to sort of identify and explore the health issues that are in a community, and to collaborate with the community in order and create a dialogue in order to identify their needs and work to create solutions. So this involves canvassing neighborhoods, attending community events, and finally, after all of this is done, we create multimedia products such as photography, film, audio, and text and data visualizations that sort of communicate what the community narratives. This is an example of a journalism article that was done a few years ago that it explores the connection between environmental racism and asthma in Barrio Logan.
You can check it out on Intersectional Health Project's website. It should come up Google, but I can also send it in the chat after this presentation. And we have a lot of articles about the work we have been doing.
This is just an outline that I created for students who are interested in joining the journalism team. The main goals of a journalism article on our website. So that's to identify the community is facing, the issue the community is facing, and make sure to privilege the perspective of community members. That involves interviewing community members or people who work in the area. Connect the issue to a different issue. So for example, how is water scarcity related to climate change and related to health? And finally, we want to make sure that we identify what steps we can take to solve an issue on a local level, as individuals, on a national level, and as global citizens. Thank you.
Awesome. Lastly, I'll be talking a little bit about the health education team. So this project team actually came from the community need for nutrition education. It's an example of when we were canvassing and actually asking about water quality in San Ysidro and the La Mirada neighborhood, and heard from a professor who talked about the need for nutrition education. So it's an example of where oftentimes we come in with preconceived notions of what we read on the internet or what needs to be done, but really talking to community members and starting that dialogue really lets us know how we can best privilege our resources to collaborate. So finding out about this need, this project can really combine your passions for art, graphic design, and public health, because the goal with this project is to create zines. And in case if you don't know what zines are, they're like little educational pamphlets that rely more on art to convey big messages. And currently this project team will be working on creating zines for the nutrition zines for the Global Arc Ocean View Growing Grounds and Inner City Athletic Program. So you can check out, these are some links on what zines are and how to create them if you're interested later. Okay, and yeah, that's it. Thank you all for listening. Our GBMs are on even weeks, even week Wednesdays. And if you're interested in learning more about any of these project teams, and you'll be, as a part of this Health Disparities programs, you all will have the opportunity to create similar projects, maybe focusing more on health disparities.
Thanks so much, everyone. All of you did an amazing job, and I'm just so impressed by the work you're doing. We are basically out of time, so we were hoping to have some Q&A time at the end. I'm happy to stick around if people have any burning questions that they wanted to ask. I just wanted to let everyone know that well, first of all, thank you for putting your GBM information up about the Intersectional San Diego project. I assume people are welcome there, but hopefully this gives you a sense of really the breadth of what kind of can be done to address health disparities, from journalism and multimedia through to things that are really directly relevant to health, like lead in water. And I think it also shows that just as long as there are students who are excited about a question and an issue, they can find ways to address it. So I'm incredibly impressed by what you all have done. Does anybody have any questions that you can't wait 2 weeks for? If not, I just wanted to also put in a plug that if you have friends who are in public health or pre-med and you think they might be interested, please invite them. This will be on the website, the recording. I'm going to try to get everyone to give me their slides so we can put those up as well. And of course, people are welcome every 2 weeks to our events. Thank you. All right.
Bye.
Bye, everybody. Thanks for coming.
Thank you.